Assemblyman Brabner, you may now join this debate.
Thank you, Madam Presiding Officer. Following listening to the member speak, and I'm sure he's about to leave, as per usual, I am wondering, Madam Presiding Officer, who is the we that the member kept referring to? Because by no means could it be the we, Madam Presiding Officer, who had the opportunity for between 2001 to 2021, 5 terms unbroken, 5 terms with Big Brother in Trinidad, 5 terms having had finally the Dispute Resolution Commission report, which said that the Tobago House of Assembly now had way more monies than the previous administration. It cannot be, Madam Presiding Officer. I am wondering whether the member is announcing to the people of Tobago that a brand new party is now being formed, Madam Presiding Officer. This absolutely cannot be the same organization that was running for 2001 up until 2021 with 15 years of their Big Brother in Trinidad, Madam Presiding Officer. This absolutely cannot. So maybe I need clarity. Because Tobago is not fooled, Madam Presiding Officer. Tobago is not fooled. But the Tobago People's Party, who has had the pleasure following Tobago saying to us in a resounding way as he leaves in 2021, saying in a resounding way that they want to give another organization the opportunity to run this island. I am stunned. I honestly don't understand what just happened. But it was clear that it was a campaign strategy that was sent up from Trinidad, or probably it was brought up because I understand there's a meeting this afternoon that their leader and so forth coming to. Maybe it was brought up this time and said, go, deliver, which they did. Madam Presiding Officer, the members of the executive has had the pleasure of looking at what the people of Tobago have said that they needed and used our time, our talents, and our God-given strength to provide for them in a time and in a space where we came up with the greatest level of opposition. You know, I was in, I did an interview yesterday evening, and when asked to grade our work, Madam Presiding Officer, I had to kind of sit back and reflect on the fact that no other administration has come against the level of opposition that this Tobago People's Party administration had come against. And I keep referring to the fact that they actually sent police in my grandfather's house. A home that is noble, a home that the gentleman did not even allow cards to be played in the home because he held it with such esteem. And police run up in my grandfather's house as part of their opposition to what we were doing to the people, for the people of Tobago. And with that, I say to my colleagues, stand tall and stand proud. Because the monies that we were given to manage on behalf of the people of Tobago, we used it wisely, and we used it with common sense, we used it with visionary thought, and we used it in a way to allow the people who will go towards an election whenever it is called to be able to truly compare what they did in 20 or 21 years compared to what we were able to do in just 4. So to my colleagues, stand tall. Yes. We did well. Yes. I want to highlight really quickly, Madam Presiding Officer, some of the successes, because the question keeps coming up, what did you all do with the money? Some of the successes under the jurisdiction of the Division of Health, Wellness, and Social Protection, and my aim is really not to use the whole 30 minutes of time. But just to highlight really quickly, within that period, the Tobago Regional Health Authority had the pleasure of onboarding at least 760 additional members of staff. That includes the doctors, the nurses, the allied staff, the support staff, the administrative staff, the daily rated workers, 760 people to be a part of that. Which is why I will stick in here that when the Tobago Regional Health Authority has asked for their subvention every month, and part of it goes towards paying staff, when we hand over the at least 40, and in some instances we're going up to 45, and I am hoping that by the end of the year we will go up to $50 million every single month to provide the kinds of services that they do. It is because we are making these kinds of investments. Of course, we have the cataract program that we've been doing. Over 2,000 surgeries have been done thus far, and if you are listening to me, you are probably one of those who've been called this week again to come back and get your assessment done, because we're about to start a new cycle of that program. By the way, these are individuals who were sitting there since before COVID waiting to have cataract surgeries done. Our major equipment purchases at the Tobago Regional Health Authority, and that includes all of the little things, the big things that we need to provide the service. This administration over the last couple of years has invested over $53 million in equipment and so forth for the Tobago Regional Health Authority. And that is why when we speak about going forward and making the little changes, and I want to take this opportunity to thank every single member of the Tobago Regional Health Authority for their hard work. And I know every single Monday morning when you wake up and you see the members opposite trying to disparage the kind of work that you have been doing, it is a very difficult thing to stomach. And every single Monday morning when they try to take a letter to OPR, it is your good and hard work that they are trying to taint. It is a hard thing to stomach. But know that as the Secretary with responsibility for health, wellness, and social protection, I thank you. I thank you for doing the work that most of us can't even think about doing. Forget the naysayers. You continue providing stellar service to the people of Tobago. We have done the collaborations. Something as simple as bringing Dretchy. These are the people who test for hearing. And instead of you having to go to Trinidad to get your hearing aid tested or to get the battery for your hearing aid, bringing them to Tobago and doing those kinds of collaborations to ensure that you get the service you need. Over the period, Madam Presiding Officer, we have spent, and this is outside of what we do at the Tobago Regional Health Authority, we have spent over $5 million providing big and small medical support to people. That includes somebody who needs probably $2,000 for a pair of glasses, or somebody who needs $50,000 for prosthetics, or somebody who needs $150,000 to do some kind of surgery that they are waiting for a while and cannot wait for the public health system. $4 million at least in household items. That is when your house burned down and you need a little fridge and you need a little stove. My social workers have been going through it and ensuring that that kind of support is provided. At least $1 million in actual food card distribution. And none of those came from my back pocket. Let me just again put that on record. Madam Presiding Officer, the member spoke about the fact that they were the ones who gave birth to CPEP and URP. But I am wondering if they are the ones who gave birth and just said to them, "Oh, you figure it out." No kind of increased wages, no kind of security of tenure, no kind of even a sick leave, no kind of anything like that. But you proudly just say you make them and abandon them. This administration is the administration that took care of the child you abandoned. And dare I add, Madam Presiding Officer, that the litter eradication program was one of those programs that they birthed and abandoned. And those members of staff now actually have proper, decent wages. They could now be sick a day and stay home from work and not get penalized. They could actually take a day holiday or 2 days holiday or 3 days holiday. Again, you birthed them, you abandoned them, and this Tobago People's Party administration rescued them. And Madam Presiding Officer, the last thing I'm going to speak about as it relates to our accomplishments at the division has been something as simple as working through when we grieve and when we go to funerals. There's actually a place for you to go and refresh yourself, for you to go and use the washroom and so forth. And we proudly can say that we've been doing it slowly, but we've been spending over $4.5 million to ensure that the cemeteries in Goodwood and Argyle and Plymouth and Castara, and soon we will be opening the one in Delaford, that those now actually have facilities for you to just go and use the washroom if you are there and you need to. So, Madam Presiding Officer, the members opposite keep talking about we will, as if they were not there from 2001 to 2021. We have. The TPP have been. And with the people of Tobago standing firmly with us, and I didn't say behind us, but standing firmly with us, we will continue to do the work that those individuals have asked us to do. So our priorities, and when the councillor spoke about the 30-something million, I find it is some kind of little bit, because I know we have plenty of things we plan to do this financial year. That includes continuing the work at Signal Hill, Madam Presiding Officer. The contractor is on site now, and finally the staff at Public Health, the task force staff, and then we will also work on the garage and so forth. That project has finally started, and we will continue working on that project. Ensuring, for example, that the vector lab, where we can test for mosquitoes and that kind of stuff, that work is happening as we speak, Madam Presiding Officer. I heard the member speak about this digitization of Tobago. And every time a member of the People's National Movement says the word digitization, my belly boils, Madam Presiding Officer. Because the reason at this point, and it is actually because, it kind of is bruising my pride, because digitization of social protection is one of the projects that I spoke about last year. And at this point, I still need to speak about it because of the because of the mismanagement and the works of those opposite who actually said to a UN agency to not continue working with the Tobago House of Assembly because it will make the government look bad. And the UN agency that was willing to give the Division of Health, Wellness and Social Protection $50,000 to start the project did not start. The contractor had already started working on it, and the minister actually called them and said, you all stop it because you will make my PNM government look bad. You all have the gall, Madam Presiding Officer, to come in here and speak about digitization when that is what your friends and your family and your colleagues did to these people of Tobago. No. So it is something that we now have to kind of almost start from scratch and figure out how we're doing it again. How we're doing it again. That is a priority. And let me go to some of the other big priorities for the Tobago Regional Health Authority. We will continue with the refurbishment of accident and emergency, and I will say to the people of Tobago now that if you go to Scarborough General Hospital right now, you will see there's a bit of upheaval happening at accident and emergency. And that is because we've actually rethought, and I said last night in the interview that a part of what I do is to sit down and listen to people and figure out what parts of the system needs to work better, what parts of the system we need to evolve so that we don't get the complaints that we normally get. And part of what they're doing, Madam Presiding Officer, is actually reworking how A&E flows so that as soon as you come in, there is a space for an actual doctor to see you immediately. And after the doctor sees you immediately, we will then determine whether you are a true emergency that needs to go in one time, or if it's just a little cut and you could sit and wait for a little bit while we treat with the heart attack that is happening there. So we are actually trying to rework the space so that even if we are saying it's a little cut and you could wait a little bit, we still have other doctors on the other side who could treat with you with the little cut. You may wait a little bit, but we are reorganizing how it functions. So we're saying to you, give us a little bit of time as we work on that, and as we work on improving how our health centers work as well. The MRI machine, it is one that has been a sore. And as a matter of fact, I probably need to say as we continue the conversation about how much healthcare costs, even though we do not have, the MRI machine is not functioning as it should. Part of the normal process is if we cannot get it in the public health system, we pay for it in the private system. So we will send you to a hospital in Trinidad. If we can't send you to Port of Spain or San Fernando, which is in the public system, we will send you to a private facility and we will pay the cost for that private service. That is a normal part of how this works. By the way, we've been doing it for regular people. We've been doing it for former members of the Assembly. This is just part of what we do, Madam Presiding Officer. So when we talk about increasing pieces of equipment, MRI, our hyperbaric chamber, because it was the only hyperbaric chamber that we had in the hemisphere. And it was there for quite some time. As a matter of fact, I think when the TRHA got it, it wasn't even new back then. So we are now working through the scopes and so forth to ensure that when we get one that at least 4 people could be in at the same time, which is why, Madam Secretary for Finance, the figure that we're giving you looking so high, because we want to make sure it is one that can accompany, that can have accommodate more than one person at a time. And of course, Madam Presiding Officer, I think I want to end with speaking about what we are hoping to do at the Palms. And I want to talk about the Palms because when word came that the Tobago Regional Health Authority was acquiring the property known as the Palms, The members on the other side somehow assumed that we were just buying some villas to Lime. And I am thinking the only way you can think that that is what we were doing is if you know that is what you would have done. Because I cannot even envision why you would think that that is what was happening, Madam Presiding Officer. But one of the first things that we are going to do, and we've already identified which of the villas we will use, is to create a full oncology space. And we are collaborating with our partners in Trinidad, with some of the other RHAs in Trinidad, to actually build out the scope so that the oncology department can finally move from the little space that they are in up the fort to this purpose-built, in essence, facility to provide the kinds of services that are needed for our oncology clients so that they do not have to go to Trinidad for the things that they go to Trinidad for. And because the villas are there and because we've done the assessment and because they are in really good condition, we will just need to fit the oncology services into one of those. And we will continue building out the other facilities, the other villas. So no, even though you guys would have bought it just to Lime, those of us on this side actually can think through what we need, what the people of Tobago need, and make those critical decisions on behalf of the people of Tobago. Madam Presiding Officer, I would really like to end by saying to the entire island, and particularly to the members of my electoral district of Belgarden, Glamorgan, that the question of how well this Tobago People's Party administration did needs to be done with fairness and with justice in mind. Given the resources that we've had, given the myriad of opposition that we have come up against, given the huge needs that those who were there before us left you with, we ask you to honestly and fairly grade us. And if you honestly and fairly grade us, then you would recognize that giving us an opportunity to continue the work that we have started is the only answer coming up. And because we recognize, Madam Presiding Officer, that the people of Tobago will do what is fair and what is just for themselves, we want to thank them in advance for their continued prayers, their continued support, their continued, they come up to us and they just say, we really just want to see you because we want to see your face to tell you you're doing a good job. Thank you to the people of Tobago for that. And this Tobago People's Administration will keep working because our gold star is sure. It is to make Tobago the greatest little island on the planet. We have started the work and we simply need the opportunity to continue. I thank you.